you start showing some of the first signs of rabies, which are very vague, flu-like, you're going to wake up in the morning, you might have a fever. You might have some aches and pains. You just may not want to get out of bed. That's going to be experienced for a couple days. Thereafter, a very short period of time, you're going to get into a very acute neurologic phase. What does that mean? That means you're going to have hallucinations. That means you might feel tingling at the site where you were bitten at. You may not be able to sleep. You may start salivating to the extent that you need several boxes of tissues to wipe that up. Very shortly thereafter, you're going to have problems breathing, you're going to have problems with your heart, and shortly thereafter you're going to go into a coma, paralysis, and death. All of that happens over about 14 days. Prevention of exposure and prevention of disease before clinical signs are what it's all about. Because if you start showing signs of illness, you've bought the farm, it's over, it's too late.
During this time, medical treatment is ineffective and sedatives are administered to help comfort the patient. The first sign of rabies in an animal is usually a change in behavior. It is important to remember that while many health conditions will cause a pet to have a change in behavior, rabies is a progressive disease, so the health condition of the animal will only get worse until it dies. Animals that have rabies usually stop eating and drinking and may seem to want to be left alone. Early signs may include a change in the tone of the animal's voice because the rabies virus infects the voice box, chewing at the site of the bite, fever, a loss of appetite, and other subtle changes in behavior. After the first signs of rabies appear, some animals become very aggressive and bite other animals and humans or even inanimate objects. Animals may also become very docile and are difficult to wake up. Rabies in animals quickly develops into paralysis and ends in death.